So this is just a question. I'm going to paraphrase it, and I think I'm going to direct it particularly at this moment to David and possibly to Madeline, although I might come to Mike as well just to sort of pick it up as well. So how do you envisage the current tech market being disrupted in a way that would transform the way we change people's lives? The digital switch is the perfect opportunity to change how we do things, but we appear to be adopting how we currently do things. How do we actually move things on? So I'm going to start with Madeline. How do we take this opportunity?
It needs a revolution, I think. So what I was hearing this morning from that report, and it was a shocker, was we need more community-based services that actually relate to people's real needs, but also their aspirations to live in a particular way. And we know we haven't got that. And we can tinker around the edges, and we can even tinker around the edges using clever technology, but actually we have to disrupt this system entirely. And so, I felt so powerfully that I wanted to take that couple of minutes there to say, this is revolution. This has to be a real change. It's culture change. It's the development of innovative partnerships, and it has to be a new way of doing business. Enough tinkering.
Thank you. David.
So this is brilliant. You get this on the app, and you can read through the question carefully before you answer it. So the first thing is that Chris says is how will it include some of the key players in machine learning and AI? I think that's absolutely critical. So yesterday at our board meeting, we were looking at the special interest groups that we've put together, which are looking at some of the key developments, including this. And I think the first thing is to include those organisations as far as they want to be in this discussion. And in the strategic leadership roundtables, which has been written up and published for this conference, we did have some representation from Microsoft, for example. Secondly, I think how it's the perfect opportunity. How do we do this? And I think the whole thing about this is the interoperability bit, to make sure that we are able to join up those consumer technologies, but also to utilise the data, which is quite rich in this, to actually inform ourselves and organisations about people's needs in real time. And I think that is... So there's obviously the excitement of the opportunity, but also to make sure that that actually fits in with those principles. And I absolutely agree with the point about if we plan for today to perfect today's world, we'll be out of date tomorrow. So we have to do that horizon scanning and work out together how we can make sure this venture moves forward in a concerted way. So I think that's the intention of both TSA and Tech Quality.
Thank you. I'm just going to quickly come to Mike, and I might come to Rafa as well, just to sort of particularly ask this question about the use of AI and machine learning and what we can draw from international experience as well. But I'll come to you in a second. Yes, Mike.
Yeah, I mean, certainly from our experience in Leeds, there's three things that stick out. One of which is, the rapid advancement of technology, and we think really particularly around potential of Internet of Things, but also wearables, some of the apps, AI, I'll let you cover that. I think the second thing, though, is really important, is the use of generic devices. Not everything has to be specialised, so the potential of Echo and Alexa, but even things like Facebook and WhatsApp, which leads on to the third one, which is about staff and real need for all staff to be digital champions. And it's not just about staff having training, it's just recognising that you can do that. So I still think it's rare that social workers, district nurses, whoever, would say to a family they're working with, oh, you should set up a WhatsApp group for your mum, but go home and have a WhatsApp group for their school run. I think they just haven't thought that that's part of their role. So I think there is something about staff, particularly frontline staff, being a vehicle for using that generic technology to support health and well-being.
I'm going to come back in a minute to something that sort of builds on that David said earlier about sort of the blending of the specialist and the everyday in terms of technology. I'm going to come back to sort of ask the question about how Tech Quality plays a part in providing the sort of assurance that the public would want around all of that. But can I come to Rafa and just sort of get that sort of international perspective both on AI, but I also just want to tack on another sort of question which is from Anonymous, which says, how do we make the change we need when we operate within a political cycle that is just not long enough enough to have a proper long-term approach to driving better outcomes?
Okay, I think AI is being used in several European countries in stroke. But actually, I think the comment is, first you have to do, for example, what London did with stroke, because otherwise you're using AI in the wrong way. What London did, as you know, is move forward. Instead of having few stroke interventions across 18 sites, they have it around 7 or 8 sites, and that was done through clinical leadership, etc. So once you've done that, then you can start introducing technologies to move forward. But if you're using AI in the wrong organizational situation where you just have too few patients being seen by certain clinicians, then I don't think AI is going to be adding value, which is what we heard before. How do we get a longer term? Well, I actually think the ICSs and in here definitely, and I think in other places, are going to get signals that they can be thinking in 3-year term thinking. So there should be thinking about investments over a 3 or 4 year period, because if the policymakers are serious, they know some of these changes that we discussed this morning cannot be pulled off in a 1-2 year planning cycle. So I think we are going to be seeing examples of multi-year cycles.
Thank you. There's another question about leadership, which again comes from our friend Anonymous. And it says, leadership is a key driver, key to driving change. Good leaders are engaging in these types of events. How do we get those who are not engaging to engage? Especially relevant to getting care fundamentally valued and having a wider impact on people's lives. I'm going to sort of come to someone who's working, if you like, inside government, inside of the NHS in Scotland, and ask Mahmood sort of, how do we get those leaders in our systems in Scotland, in UK more generally, that aren't engaging with this agenda, to see it as an agenda that's relevant to them, but as leaders within the health and care sector?
Well, Paul, no one has cracked this nut very easily, because we need to be very clear among ourselves that what are our common challenges, because once we are very clear what are our common challenges, then the chances are that people will be able to come to that particular table when you can discuss. Let me give you an example. You mentioned Scotland. We have got 31 local authorities and we've got 14 health boards, and then they are very much integrated. And then we were looking at, we have got a very strong data which tells us where our people who have got biggest health disparities or health inequalities live. And we wanted to engage with the local authority leaders that this is something we can work together. And I think the data played a very, very important role, that when we were able to show them on a dashboard saying, look, this is in your patch. You as a leader of that health system have got the responsibility, but we are very happy to support you. And this is from the top, working with the Scottish government. They were very keen that we should give that intelligence and the reality. So that is the first thing you have to do. Second, building their skills and capabilities, not to having the fear of unknown, because sometimes we put position in those roles, and then they are unable to deliver because either they don't have the skills or they've got the fear of unknown. And I think that is where I must say there are 3 things. When I talk about health and care sector, the 3 skills are becoming paramount. And if you really want that those leaders need to perform, these are population health management, quality improvement, and understanding the data. And I think that means that first, if they are able to understand the problem, and second, giving them the skills so that they can perform. And third, we need to have a support network around them.
Great. David, did you want to pick up on that?
Yes, just 3 very quick points. The first thing is, who are leaders? So actually, if you're a middle manager or somebody working at a lower level of the organisation, don't assume you're not a leader. You are probably, because you're closer to the action and the needs of the population. Who would say, after hearing Mike this morning, that he wasn't a leader? He is a fantastic leader, but some people just don't know it. So think about yourself as a leader and who you need to convince, who may be in a more superior position. The second and third point are, people are convinced with their heads and their hearts. So with the evidence base for something that works, at the heart are the stories about the things that make a difference in people's lives.
And that's been very much a feature of the work we've been doing with Care England. You'll hear more about that from Martin Green this afternoon in terms of the development of tech stories from the care home sector, but also the work we did with TLAP last year around tech stories from a whole range of people with working age and disabilities as well. I'm just going to quickly look out to the audience because I think there are some microphones, and if there aren't, yes, there is. There's a man with a number over there, and another one over there. So can I just see if there's any hands who would like to ask a question, not having typed it in on here, either because you don't have the app or you haven't used it yet? I might just pick on someone if I'm not careful.
The look of panic on the face.
It is, no. I'm going to keep the lights up, but I'm going to just ask one question that is on here, which came from Gordon Sutherland from Tunstall. And I'm going to sort of direct this at David because he's probably the font of knowledge on this. And it was just to ask, what can the panel have? Is there any update on the green paper? Will it come back or in the long grass? So just say something about that for us, David.
Well, people like Paul and I have been beavering away trying to put pressure on the government which has actually sometimes reached the papers, to make sure that we are moving forward with a system that actually is sustainable financially in the current means-tested system, understands more about legislates for more pooled risk of need. So the point that was made by Raphael earlier about those systems that are more insurance-based or self-paying don't do quite so well on integration. Some of the reform issues and how we pay for the above, all of the above, given that social care is only 1% of GDP currently. I think so over the last 20 years and in the last 2 years that there's been lots of noise about it. My personal view is that some government sometime will have to get hold of this and do something about it. We've just got to make sure that those of us who care about it are putting pressure on to make sure we provide a viable social care system in England and indeed in all the four jurisdictions of the UK. So I think the work continues following the Queen's speech. It was in the Queen's speech. It was in the previous two Queen's speeches. We've got to make sure that there is some action to address this rather pressing issue.
Yeah, I got very excited yesterday when the Queen's speech and Her Majesty said in the Queen's speech that my government will bring forward proposals for older people's social care, I think it was. And so I went to the detail, because there's a 138-page document that provides all the detail of what has been covered off in the Queen's speech. The detail on social care was simply to repeat what was said in the Queen's speech. There was no detail. So we await with bated breath whether we have a white paper, a green paper, or no paper, or a piece of legislation to move this agenda forward. I'm going to end with one last question, which I think I'm going to direct to the whole panel. And really it's about giving advice to power, giving advice to regulators, to government. How do we drive the quality and improvement agenda around technology-enabled care and technology more generally in health and care? What would be your elevator pitch, your key point, if you had the ear of a minister or the ear of Ian Trenholm, Madeleine, that you would want to leave them with that would make a material difference to the sort of direction we're going in when it comes to quality and quality improvement? And I'm going to randomly start with the person who mentioned the CQC in her presentation and start with Madeleine and go along the panel.
I think it's moving to build a quality standard framework for novel service delivery. Because in our brave new world, we want to see new and innovative models of service delivery, not just tech, but tech wrapped around with new ways of doing things with the workforce, trained and empowered to deliver in that way. And I think we are seeing some really new and exciting new models of care service delivery, which really do respond to individual need and community need, and that's very exciting. But they currently sit outside the regulatory framework because no one quite knows what to do with them. We have to know what to do with them. And TSA, I think, has a really significant role to play there in terms of developing a quality standards framework that can actually adapt to new service delivery models that are technology enabled.
Thank you. Mike, your advice.
Yeah, a few things. I mean, I think one, not surprised as a local authority person, I would stress the potential of that and the assurance that comes from a local authority. There's lots of digital projects, but the ones that I always feel better about in Leeds are the ones that directly link to things like telecare. But I think linked to that, and it goes back to the money, is the potential to move from all that short-term project funding to what really do we need to mainstream for improving people's quality of life and invest to save. Secondly, I would include within that the role of the local authority also in terms of self-payer. So what is our role in terms of signposting and giving good people good information, or how far does the local authority move into the self-payer market? But the third thing I want to stress, because that was really good, Paul, you mentioned asset-based approaches and asset-based community development. What I really want to see around people are developing community-based digital circles of support. So yes, they may well be linked into telecare, but can we not start to think about how people are linked into the local third sector, but also friends, neighbours, those sort of people with the right permissions that get that information about how people are functioning. And I think that's where you get a community response to support people, which is at the heart of the direction of where we're going.
Thank you. Really helpful. David.
3 things. First of all, invest money and in people skills to develop the innovation. Thirdly, have an oversight and a coordination role at a national level for some of the major changes, particularly analog to digital. So in Sweden, where they invested in it, they wrote, having made a bit of a mess of it to start with, they saw a dramatic change for the better. And the third thing, which comes up to quality, is adopts some standards which must be adaptive to the changing environments, which are properly informed by the user perspective. And in tech quality, of course, we have some, which are UCAS accredited, so we're happy to help with that. But I think those are my 3 things that seem to me to be important.
Thank you. Mahmoud.
First of all, I think talking about the standards, we need to be moving away from quality assurance to quality improvement. So this is excelling rather than maintaining the minimum. Second one, I would prefer to have a minimum core data sets, which the whole industry should be collecting, so that we should be in a position to see that how we can take the tech industry and understand what is the standards of being maintained, the minimum core data sets. And the third one is that we need to have a learning culture. And it means that from local, national, and international, we need to have the think tank or the common grounds we can establish where we can have that dialogue so that we can keep improving.
Thank you. And Rafa.
Well, in an elevator with a politician, first I would say something about Brexit that they might like or not like. But the other key point that you're mentioning is we know from the UN and from developing countries that poor people don't go to poor quality services. They don't. They continue going to chaman or they go to a sorcerer of some type. They don't access either social or health care of poor quality because they know that they are not going to get a good service, even if they're very poor. And the link with that, with technology, is sort of obvious from this conference that you can, of course, improve quality using technology in the right way.
Great. Thank you very much indeed. I think we had some really useful feedback from colleagues. And I think one of the golden threads that runs through that is, one, being clear about what the standards are and having a framework for those that can provide people with that assurance, but also can drive quality improvement. And also the centrality of making sure that we have the workforces that are skilled and empathetic and engaged with the individual, but also the potential and opportunity of how the technology can be used to help that person live the life they want to lead. And really grateful to all of you for your contributions. Thank you very much. Let's show our appreciation. And now we're going to break for some more networking for lunch and the exhibition. So thank you very much, and we'll be back this afternoon in here at 3:40. Thank you very much.